So now we are making a long arm elbow splint. So obviously it is meant to immobilize and protect the elbow. So with elbow splints, you can either involve the wrist or not involve the wrist. So for this one, we are not going to include the wrist. So we're going to start by making a pattern on our paper towel. So we're going to start by tracing our pattern, but we'll just kind of trace around the extremity first. And we're going to start right short of the wrist, and so you can kind of feel where that ulnar head is and stop before that.
Yeah, so we say that he's going to get out there in about another 15, 20 minutes. About 15, 20, something like that.
Okay. So now once you have your arm traced, you can ask the patient to move it to the side. And then from here, you'll usually do about double of that width on either side so that it comes up to the sides of the arm. So this side looks good.
Do you need to mark where the elbow is?
And then kind of the same thing up to the forearm, which I've kind of already marked here. And then once you get to where the elbow joint is, you're going to give yourself a little bit more room since you're going to fold those sides over to avoid the lateral and medial epicondyles. And so you're going to come out to the sides just like this, 4 inches or so. And those are the portions that you're going to fold over once you cut it out. So once you have traced your pattern and cut it out, you can also apply it to the patient's elbow to make sure that it is fitting properly. And once you have determined that it is, then you can go ahead and trace it onto your material using your wax crayon. And so the good thing with the elbow too is that it should be pretty symmetrical on either side, and so you can always flip the material over to hide these markings. Alright. Once you have it traced, you can then use your box cutter to cut it out, or you can just dip it into the water if it's big enough to go in there. So once you've cut out most of your material, you want to make sure you cut the actual pattern out that you've drawn onto your material. And so you want to kind of hold the material that you're taking away rather than the actual split material you're using instead. And you want to use nice long strokes to make sure that the sides are nice and smooth. You want to make sure that they're nice and smooth so that they're not jagged and poking your patient. Obviously you can move your material as you please to make it easier for you. Okay, so we have now re-dipped our material into the hot water and is ready to be put on the patient. And so I'm going to put the wax crayon side down. Alright, sometimes it's helpful to have a tech help you with this, or just a second person, because you are kind of dealing with both the forearm and the elbow. And so with this with her elbow on top of her head, it kind of allows this to stay on top, so you can kind of just fiddle with the elbow splint itself. And so you can see here, I'm folding down the sides on both sides. and you can kind of push it down to make sure that it stays there. And then make sure that it kind of holds and forms to the upper arm. Are you able to hold this one? All right. Okay, I'm just gonna go check the other side. And then once you kind of have your general form made, you just kind of wait until it cools down and hardens. Okay, so now taking a look at this, everything looks good. I will end up kind of cutting this a little bit shorter just so that it's not riding too far into the axillary area. Okay, and then you can take it off the patient once you know it's nice and hardened, and we can worry about the straps next after I cut this down. Ready?
Yep.
All right, so now we're gonna put the Velcro and straps. And so we're gonna have 4 sets of straps. One's gonna be at the upper arm, one's gonna hold the forearm, and then 2 straps will be crisscrossing at the elbow to make sure you hold the elbow in place. All right, so start with the easy one. So right here at the forearm, to hold the forearm in place. Round those edges later. Right. We'll have one again at the upper arm. Right. And then we also have the ones that are crisscrossing. And so people do this one different ways. I tend to, cut the strap in half, or just use the smaller straps. Alright, you can pause it for a second. Alright, so now for one of the trickier parts of the splint is doing the crisscross at the elbow. And strap placement here is very important because you want to make sure that you have enough mechanical advantage of the strap to keep the elbow in place. And so to kind of figure out where to put the straps, I like to kind of fit the straps first onto the patient before putting the Velcro. And so you know that you're going to do the X right at the elbow crease. And so here you can kind of see where the 2 straps will join at the top. And you can kind of mark with your crayon where that is. And that's where your Velcro is going to go. And then same thing at the bottom. You can kind of mark to see where those straps are going to stay. And mark where those 2 straps will join. Pause. Alright, so then after you've marked those 2 spots, you will just stick where that yellow mark was, and then the other one right back here. Alright, and then you can go back with your strap and stick it on either end. Go around this way. And then the same thing on the other side. Crossing at the elbow and meeting at that point. And you can kind of see where that X was formed, where you put your straps. And then you can just cut that excess, which that looks like it's pretty good.